Do you have a dachshund and have questions on topics like training and nutrition? Do you want a dachshund and need help locating a breeder or finding a great rescue? Did you have a dachshund growing up and want to share some funny or heartwarming stories? Then you're in the right place. Welcome to the Wiener Dog Lover Podcast, the place to be for all things dachshund. Welcome back, Wiener Dog Lovers. Today's episode is a little bit late, but I wanted to make sure that it was perfect. I am speaking today with Dr. Dennis Thomas, who wrote the book Whole Pet Healing. And I've had this book for a while and I've really enjoyed reading it. It's all about holistic pet care and different ways to look and think about working with your pet in veterinary medicine. And if you are at all interested or curious, you may not currently have a holistic vet and even know what a true holistic veterinarian should be offering, then this is definitely an episode to listen to probably more than once. I've listened to it a couple of times through my editing process, and each time I listen to it, I find something new, and was such an honor to speak with Dr. Thomas, and I hope that you enjoy it as much as I did. He has a wealth of knowledge and a lot of really cool stories to share with you, and I hope that you give it a listen, and I hope also that you take him up on going to his website and possibly doing phone consults. If you have a dachshund that maybe isn't doing as well as you would like, then maybe you might want to do a phone consult and see if Dr. Thomas can help you, and that would be really amazing. And if you do, I'd really be thrilled if you would send me a message or let us know just how it goes and how well your dachshund is doing after the fact. And as well, if you would be interested, I would also like, if you are enjoying the podcast, to go ahead and leave a rating and a review over in iTunes, and that'll help other people that are looking for information for their dachshund to find us easier. So let's get into it. Thank you so much, Dr. Thomas, for joining us here today. I think I heard you first speak maybe with Hay House Radio and heard you talk about your book, and I immediately purchased it on my iPad, and I think now it has more highlighting than it does printed word. So thank you so much for writing this book and sharing your knowledge and experience with all of us.
Well, I'm glad you enjoyed it. I wrote that book about, now 5 or 6 years ago. It's been in publication about 4 years, I think. But I have to say that I've grown quite a bit since I wrote that book. We're always learning. We're always moving forward. So I've even been thinking about writing a sequel to Part 2 of Volume 2, just to kind of update things. So
that's exciting. I'm very excited.
Being more into the more subtle stuff. Yeah.
Interesting. Dr. Thomas, can you share with us your journey into veterinary medicine?
Well, I have been a veterinarian for 38 years, a little over 38 years. About 18 years ago, I gotten to the point that I was really frustrated with conventional veterinary medicine. It was obvious that we just had way too many limitations. There were too many things that I didn't feel were successful, that other veterinarians felt like that they were comfortable with. I wasn't content with our limitations. And so I started looking around. I knew and felt that there were other options and I needed to explore them. And the timing was right. I had a couple of patients that came in, one in particular that was an epileptic dog that had been having real trouble with seizuring. And she had taken her dog to another city to get some acupuncture done, and the dog no longer had seizures. So that was the tipping point. That was when she came back in and told me that the acupuncture had taken care of her dogs, and we had this dog on every medication that we could to try to stop the seizures, and nothing was successful. And she just talked about how simple it was, and it piqued my interest. I'd had a little bit exposure to Chinese medicine and acupuncture in vet school many years ago, but it was very, very little. And so anyway, I went back to school and learned. I went to school at Colorado State, the veterinary college there. They teach Chinese medicine and acupuncture, and I did their course. And then later I did a Chinese herbal medicine course, and then it just went from there. And I later became, about the same time, I became a Reiki instructor, and then moved from there and just continue to grow right now. That's kind of my history.
That's really interesting. Now, were you exposed at your veterinary college to Chinese medicine, or did you go outside of the college at that time?
It was a funny story. No, it was at the vet school, but it certainly wasn't. It wasn't part of the program. Actually, what happened was we had an old horse that had been admitted to the vet school, large animal facility, and this was an old racehorse with extremely bad back, extremely painful back from racing. And the owners had brought this horse. This was in Texas. I went to vet school, and they had brought this horse down from Oklahoma and left it with us, and ended up abandoning this horse. And so we ended up keeping this horse, and we were kind of stuck with this horse at the vet school, and it was extremely painful. And so we had the horse at the school for several months. And so while it was there, we tried everything. We did everything that we could to make this horse better, and we just had very limited success. And then one day, out of the blue, they called us in. I was a senior, and they called the senior students in, and we went into this facility. We had this large animal teaching facility, and we'd set up on these bleachers. And they led this horse into the room, and we all knew the horse because we had all worked on the horse. And about that time, the door opened, and about 4 of these Asian veterinarians came walking into the room, and they all had their little white coats on and everything, and they went over to the horse and started examining the horse, and then pretty soon they started putting needles in the horse, and we were kind of snickering and poking each other and everything, thinking, that this was like voodoo medicine or something. And they put their needles in the horse, and they sat and watched the horse for 15 or 20 minutes, and then they took the needles out of the horse, and then they put a blanket on the horse and a saddle on the horse and got on this horse and rode it around the room, and the horse had absolutely no pain. And this was a horse the pain was so bad that if you put your hand on top of this horse's back, it would literally go to its knees on the ground. That's how painful it was. And so to watch these people do this acupuncture, and then to be able to ride this horse within 30 minutes of seeing it and seeing this horse ride around the room, it was mind-boggling. I mean, you could have heard a pin drop. Everyone was going, "Oh my God," because we had never seen anything like that. So that was the one case that I was exposed to, but it certainly left a mark in my mind.
That's pretty amazing.
Yeah, I think what it did was it just, like I said, it just was something that I never forgot. And then when I started looking for ways to expand my options and the things that I could do I called them more trump cards or more tools in my box, then that was certainly the first thing that I went to. So, yeah. But, the thing that's interesting about my history and about going into alternative medicine, and that's one thing that I'd like to address, and I don't want to forget that, and that's the difference between conventional medicine and integrated medicine and holistic medicine, because there's a big difference. And it's kind of like what my history was, because I did conventional medicine for many, many years, and most veterinarians get very content. They get very content with that and live within those limitations, and we just assume that there's nothing more out there, and those patients that we can't do anything for, or that we run out of options, or that we have bad options, we just learn to live with them, and most veterinarians choose just to do that their whole career. I wasn't like that. I felt the need to move beyond that, and I did. What I did was, when I decided to go back to school and learn Chinese medicine and acupuncture, I basically wanted to go and focus on pets that had chronic pain. That was my interest in doing this. I was looking for something that I could help these pets that would get to the point that they could no longer get up because they were so painful, and we would have to put them to sleep. And so I knew acupuncture was really good for that, so I wanted to learn. So basically, I went back to school with the attitude of, show me where to put the needles, because I want to treat these pets for pain. And they said, no, that's not what we do. We teach you Chinese medicine, and acupuncture is the mechanics of the philosophy or the mindset behind Chinese medicine. And so I didn't realize what I was getting into. I was just looking for more tools for my toolbox. But what happened was I learned a whole different mindset. I learned to look at the body from a different perspective, from a Chinese medicine perspective, and that changed everything, because I no longer saw the body as just form. Chinese medicine is about the energetic body. And so I started learning about the energetic body and its influence on the physical body. And I was intrigued. I was just totally intrigued. I couldn't understand it. I couldn't understand how we could do things, using Chinese medicine that didn't make sense from a conventional standpoint. And the reason was because I was used to dealing with the body as only form or matter, and Chinese medicine was dealing with the energetic body. And the perfect example, I remember years ago, I had a boxer that came in, and the boxer had a prolapsed disc in its neck, severe pain, had some paresis in all four legs, and the dog was too old for them to do surgery, and so they opted not to do surgery. And so I was going to do acupuncture on this dog, and in my rational mind, my conventional, my conditioned mind, because I was conditioned to conventional medicine, which is what I call reasoning, intellect, linear thinking, that type of thing. And so now imagine this. You have a disc in the dog's neck that's ruptured, and this disc material has gone up into the spinal canal and is putting pressure on the spinal cord in the area of the neck. Okay, so it's like taking your fist and shoving it up to the bottom of the spinal cord and putting pressure on it. Or it's like having a rock in your shoe, and you're standing there, and the rock is putting pressure on the bottom of your foot. Well, that's what a disc does, and the pressure, the mechanical pressure, causes an ischemic necrosis, or the blood supply can't get to the spinal cord, and those cells start to die, and that's why the paralysis sets in. Well, in conventional medicine, we realize the only way that we can solve that problem is to go in there and surgically remove that disc. It's like taking the rock out of your shoe. It's that simple. You can't relieve the pressure unless you remove that disc material. That's why we do the surgery. Okay, that's conventional. So if you have a dog that ruptures a disc and they've got damage to the spinal cord, the only treatment is to go in there and to surgically remove that disc material. It makes sense. But it makes sense only from a conventional standpoint, because what I didn't realize was that everything is energetic in nature. Okay, the spinal cord is energetic, the disc material is energetic, everything is energetic. And so with Chinese medicine, what we're doing is we're manipulating and moving the energy. And so it's when we see it as energy, then it makes sense that we can do things for it. And so what we do is we treat it with acupuncture, and then the symptoms usually resolve. Over 18 years, I've probably treated 40 or 50 dogs that were paralyzed. And these were dogs that were told that they would never walk again. Some of them had MRIs done. Some of them had even had surgery done. And these were dogs that came to my office that were classified as having a dead spinal cord, no function at all, would never walk again. And their only options were to put it in a cart or to put it to sleep. And most people end up putting them to sleep. Well, I treated 50 dogs that were totally paralyzed. And out of those 50 dogs, 49 of them got up and walked again. I only had one dog in 18 years paralyzed dogs that did not get up and walk again. I even had one dog that had been paralyzed for over 5 years that heard about acupuncture and came in to see if it would work on that dog, and that dog got up and walked again. Once you stop thinking specifically about conventional medicine and the scientific or the science that's associated with that, and you move into something that's got a different set of laws, then you expand all these possibilities. And it doesn't stop there. It continues and it continues and it continues, because when I started seeing the results of what I could do with acupuncture that I couldn't do with conventional medicine, I had to learn how's this work? And that's the problem that science has had, or conventional medicine has had, with alternative modalities. They accept that it works, but because you can't explain how it works, then they won't recommend it. Because anything they can't explain how it works scientifically, they deem it it's not scientifically proven, so we're not going to recommend it. And the reason it's not scientifically proven is because we're using the wrong science. Because remember, in conventional medicine, just like I said, we see the body as form, and all laws of form and matter are what we call Newtonian physics. Those are the laws of matter. But when we're dealing with the body as an energetic, entity, which it is, then that doesn't fall under the Newtonian physics. It falls under the laws of quantum physics or quantum science. And so they're trying to explain how Chinese medicine and energetic medicine and what have you works using the laws of matter, and it doesn't work. But as soon as you start understanding how quantum physics works, then it easily explains how it works in the body. So that's what I did. I went back and learned quantum physics and how it worked, and then I could explain to people scientifically exactly how it works. And then once that people believe in it or open to it, then that's when all the little fun miracles start happening. And you guys are working with dachshunds, and I would tell everyone out there that has a dachshund, if your dog starts having problems with its back, please go to a Chinese medicine acupuncturist, because that is absolutely the best thing that you can do for those dogs, especially if they've got a ruptured disc. And it's a wonderful modality. And I'll tell you, I'll give you, I know I'm kind of rambling here.
Not at all, Dr. Thomas. This is exactly what dachshund caregivers need to hear. We need to hear that there are other options. So please, go on.
I love talking about this, but I'll tell you one of my favorite dachshund stories. And I've worked on tons of dachshunds, and I hate to say it, but I put a lot of dachshunds to sleep in my early years that had paralysis because they could no longer get up, and we believe that the cord couldn't never work again. But I tell you, a really neat story that I had, and you might want to learn from this. I had one of my mentors is a guy named Dr. Shea, who's over at the Chi Institute in Florida. He's a veterinarian. Well, I was at a conference in Orlando, Florida one time, and where he was, and he and I had lunch together, and I was talking about how wonderful using acupuncture was on these paralyzed dogs. He was telling me about his experience using acupuncture, and he told me, he said, if you ever get a dog that ruptures a disc and they come into your clinic within 24 hours, if that dog has ruptured his disc and gone paralyzed within 24 hours, he told me to bleed GVT. Now, GVT is an acupuncture point at the tip of the tail. And when you bleed it, what you do is you take a needle and you just poke the tip of the tail. They can't feel it because they're paralyzed. Poke the tip of the tail with this hypodermic needle. You don't even need an acupuncture needle, just a hypodermic needle, and get it to bleed. That's what you call bleeding a point. So a few drops of blood start coming out. That's called bleeding it. So he told me that, and I had never heard that. And I thought, well, I'm going to store that in my memory bank. And as fate would have it, within 3 or 4 months, I had a lady brought a dachshund into my office, and the dog had been paralyzed for less than 24 hours, had no pain. It was dragging its legs, had no feeling whatsoever. The cord was totally dead. And I remembered what Dr. Shea said. So I put the dog up on the table. I got a hypodermic needle. I started poking it like that, got a little stream of blood coming out, and the blood probably dripped for 30 or 40 seconds, maybe a little bit longer. And then finally it stopped. And I took the dog, I picked it up off the exam table, put it down on the floor. The dog got up and walked across the floor.
Oh, my.
It was amazing. It was one of the most amazing things I'd ever seen in my life. It was the coolest thing. The dog was wagging its tail, running around like nothing had ever happened.
Now, this is obviously the first time I've ever heard of something like this. Is this a meridian line for Chinese medicine?
No, well, what it's doing is it's charging energy from the brain all the way down the spinal cord to the tip of the tail.
Wow.
It's an extremely powerful point. That's one of the things that I do with a lot of people that have pets that have spinal cord dysfunction, paralysis, things like that, is that I teach them how to do acupressure on that point at the tip of the tail. I get a dog that comes in that's totally paralyzed and start having them at home once a day pinch the tip of that tail, and then within a few days, the dog's wagging its tail again.
That's amazing. I have been in the dachshund world for over 25 years and never heard anything that remotely resembles doing something like this. And this is why I started this podcast, is so that we could get all kinds of different information out to dachshund parents so that they can help their dachshund.
And you can be in it for 50 years, but unless you change books, nothing's going to change.
You know what? I love that statement. Unless you change books. And I'm so happy I found yours. Because
and it's not just mine, because it's steadily growing. We're finally moving in that direction. We're a little bit like the iceberg. I mean the glaciers, but we're slowly moving in that direction.
Yeah, but you know what?
It's the same old thing. I tell people all the time. I went to because I'm still a veterinarian, still licensed, so I have to go get my continuing education courses every year and what have you. And I went. The last conference that I went to, I was a regular veterinary conference, so I had to go to classes with regular medicine, conventional medicine, and so I went to a class on cancer, and we were talking about lymphocytoma in dogs. And we spent 3 hours in there listening to this lady lecture, and she was one of the top veterinarians in the country, oncologist. And after 3 hours, I walked out of that room, and what I realized was that it was the same lecture that I had heard when I was in vet school 38 years ago. Exactly the same. Nothing had changed. Nothing had changed, because everyone's reading the same book over and over and over and over again.
Dr. Thomas, we all still see it and hear it about, dachshunds coming in that are down, and the only option that they're given is 2 options, either surgery or euthanasia. And
nothing changes.
Because
for steroids.
Yeah, but long term though.
Yeah.
But steroids long term isn't always an option. So if we don't get a hold of the people that don't know about other options, then a lot of dogs are needlessly euthanized, because the only option that they're giving is an option that they can't afford. And so we're needlessly euthanizing dogs that could possibly have gone on and lived normal, healthy lives.
Yeah. And the sad thing about it is that it's no longer just about those intricate type of surgeries like spinal cord surgery. I mean, when I got out of school 38 years ago, there was only one person in the whole state of Texas that was a specialist, that was a neurosurgeon. That was it.
Yeah.
And so we literally did our own neurosurgery. I did 2 hemilaminectomies first year I was in school. But the point was, when people started using specialists and more specialists came out, then what happens was we started sending all of our disc surgeries to the neurosurgeon, and so that was always, for many years that's been done, and of course that always cost a pretty hefty money, because it always went to the surgeon. But nowadays, when you look at veterinary medicine, those types of surgery are creeping into almost every part of conventional medicine. A dog with a torn cruciate ligament. The last cruciate surgery that I did, it was probably 10 years ago, and the total bill was like $800. Now they're doing TPLFs on them, and they can't walk out the door for less than $3,000. So now we have this really catchy term that we use. It's called economic euthanasia. That's just what you said. It's people that can't afford the surgery, so they opt to put their dog to sleep. When I got out of school, we didn't allow that. There was no such thing. We looked for other options. If you couldn't afford it, we would come up with another option. We had many options for many things. Nowadays, it doesn't exist like that. It goes to the surgeon. They give you one option. If you can't afford it, then you end up putting the pet to sleep. And to me, that's a crime. It goes against everything that our profession stands for.
I so agree with that. I still see it way too often.
Yeah, it's really sad.
It's a sad term.
It's really sad.
Euthanasia.
I hate to say it. Our profession, I remember the first day when I was in vet school, the dean of vet school said, "You guys are never going to get rich as veterinarians, but you're going to have a great career and you're going to enjoy it. And and it's a good job. You'll always have a good job. But somewhere along the line, veterinarians decided that they could make money, and I hate to say it, there's a lot of money that's been made in veterinary medicine now."
Yeah, that is unfortunate. A lot of animals and people suffer because of it.
Well, the sad thing about it is now what they're doing, veterinarians are saying the way to deal with it is to get pet health insurance. Well, no, that's not it. The thing is that our profession has gotten too big for its britches. And I hate to say it, but that's the case. I mean, when you have people out there, veterinarians out there that are euthanizing dogs with torn cruciate ligaments because they can't afford a TPLO for $3,500, that's not right. That's not right. They shouldn't do anything. Just leave it alone. Take it home. In time, it'll heal itself. But they certainly don't tell them that option. And I don't want to come down as being the naysayer for veterinary medicine, but I'm just saying that there's a lot of stuff that's going out there that I don't approve of. And unfortunately, that like you said, the dachshund that goes in that's got a ruptured disc that's paralyzed, and they go to the conventional person that has no experience using alternative medicine, that won't even consider it as an option, they're not giving them any options at all. I'll tell you, I had a schnauzer that came in one time that was paralyzed, and he and his wife called me and said, "Hey, I heard from my neighbor that maybe it would help." And so I told him, same thing I tell Mom. I said, "We've had pretty good luck with him. I can't guarantee it, but, and he said, it's either that or I have to put my dog to sleep." We treated that dog once a week for 8 weeks, and the dog was running around all over the place. And I remember the day that he left, the last treatment we did, and he left, he turned around and he looked at me and he said, "Why in the world would my veterinarian not give me this recommendation? Why did it have to come from I don't remember if it was his neighbor or a colleague at work or something like that. Why didn't my veterinarian tell me that this was an option?" And that's a good question. And you know what I said? I said, "I don't know. I don't even know who your veterinarian is." And you know what? He told me who his veterinarian was, and it was a guy that used to be one of my colleagues at a clinic that I worked, and he had seen me work on paralyzed dogs before using acupuncture, and he had seen those dogs get up, but he would not send a paralyzed dog to me or even recommend it. Now, if you can explain how that works, how a veterinarian can do that and know that acupuncture is an option and have witnessed the benefits of it, but not give a client that option, it's beyond my ability to understand.
I think that was basically how I was introduced to alternative medicine, is that over 25 years ago, my mom's own dachshund went down, and when at the time there was nobody doing the surgery, so she would have had to drive 12 hours to a veterinary college, and it wasn't something that was feasible. And so her only option was euthanasia. And so I had a breeder at the time, and he said, I knew he had rehabbed one of his own dogs, and before rehab was even really heard of. And so I talked to him, and he said basically the same thing you just said, bring her here. There's no guarantees, but her only option at that point was euthanasia. So already she, was getting a little extension on her life. And they took Abby from complete paralysis, no bowel or bladder control, and brought her back to up and running with all function in just over 2 months. And she lived to be almost 15 and never had another incident of IVDD. We know it can be done. They're just not often getting the option.
That's right.
My mom ended up switching.
And that's really unfortunate. It's all about the ego.
Yeah.
I had a dog that came in. It was a Chihuahua. Same thing, paralyzed. And I worked on that. The same thing to what you're talking about. It's either surgery, we could try steroids, and for a period of time, and then it doesn't work, and then it's either the card or euthanasia. And that's the same thing that happened to this little Chihuahua. It was totally paralyzed. Had been on the steroids for 2 months, wasn't any better, had no function whatsoever. And the veterinarian told her, "It's time to put your dog to sleep." She said, "I don't want to put my dog to sleep." And she took the dog, and same thing. Somebody told her. She contacted me. I worked on that dog once a week for 6 weeks. 6 weeks, that's all. 6 treatments that the dog got up and started walking around. You know what she did? She was so angry. She took the dog and she went back to the clinic, and she took it back to there, and she wanted to see the veterinarian. And the veterinarian came out to the reception area, and she put her little dog down, and the little dog started running around the room. And she said, "That's my dog after having had acupuncture." And the veterinarian looked at her and said, "No. It's the steroids finally kicked in." That's what she told us. In total denial that it had acupuncture had anything to do with it. Like you say, that there's a lot of veterinarians out there that are on the defensive and don't want to admit something that they can't explain or understand or do, and they just it's like the child that puts their fingers in their ears. I don't want to hear it.
Yeah.
I don't want to hear it. But I do want to say it's people like you that are, I do my thing, and I deal with people all over the world every day with phone consultations and stuff, and I love it because I get to talk about this all the time and what I can do for these cancer patients and so on that they've not been exposed to. But it's people like you that are sitting there talking to lots of people out there and spreading the word. And the only word has to be is there are other options. Don't ever look, and I tell people this, I've been telling people this for 18 years. When you come to a dead end in conventional medicine, or you don't like your options, or there's a dead end, or, it's no hope, then instead of just believing that, just say, hey, all they're telling you is that me as a conventional practitioner, I don't have any more options for you. And so the answer shouldn't be, okay, well, then let's give up. The answer should be, okay, well, let's change pathways and go a different pathway. And so every patient I've ever worked on, that's the first thing that I tell my clients is I say, okay, do you see that conventional medicine, we are at a dead end. We have no other options. We're at a dead end. So we've got nothing to lose. You see what I mean? So let's just jump over onto a different pathway, and we'll go down this pathway, and we'll see what happens. And everyone's open for that. And, everyone is like, okay, great, there's hope, and we all love hope. And all of a sudden you go down that pathway, and all these little things happen, and it's really a wonderful thing. I got an email yesterday from a lady that her cat, I did a phone consult with her. Cat had cancer. They had given it 2 to 6 months to live. And she emailed me yesterday, and her cat's been cancer-free for 6 months. I love it. I love it when my clients contact me and say the oncologist is perplexed. When I hear that, I just have a big smile on my face because of and what that means is the oncologist can't explain why this pet doesn't have cancer anymore. And I love it. I just absolutely love it. It happens all the time. It's not miracles. It's just different medicine. It's different healthcare. It's different mindset.
Let's get into that just a little bit. In your book, you talk about how our mindset can help direct the healing for our pets. Maybe explain how our thoughts can help with healing our own pets, and explain that to us a little bit.
That's something that I could talk to you now for probably the next 3 days without stopping, because since I wrote that book, I just gone deeper and deeper and deeper into that. One of the things that I addressed in the book is that what I call that deep connection that we have. And we all know that we have this deep connection with our pets. And it's something that we can't explain. It's just we feel it and we are aware of it, but we really don't know how that works. And so I touched on that in the book. But since then, that's been a big, big part of my focus is on the energetic relationship between people and their pets. And I'll give you an example that when in my office that I was doing alternative medicine only, and even now with my phone consults, did you know that a third of the pets that I work with have exactly the same disease as the pet caretaker?
Wow.
Exactly. I had a lady that I did a phone consult with just last week that her dog has severe degenerative joint disease in the right hip, and she has severe degenerative joint disease in the right hip. This is something that's so common that it's no longer, I no longer even raise my eyebrows to this anymore. I'm even waiting to hear it. And it's all about energy. It's just like I was talking about. It's all about the energetic body and how energy, what energy does. And that's what we've got to start understanding. And I'm going to step back to something because I don't want to miss this because it's really important.
Sure.
And I see this all the time. And it's the difference between conventional medicine, integrative medicine, and holistic medicine. Okay. Well, integrative medicine is that clinician that's gone out and learned another modality. Let's say it's a veterinarian and they went out and they learned how to do chiropractic work. Okay. And so what they've done is now they can do conventional medicine and then they have in their toolbox chiropractic medicine too. So they've expanded their abilities. They've expanded their services. Okay. And so some veterinarians, they do chiropractic, they do acupuncture, they might do homeopathy. They might do 3 or 4 different things. And that's integrated medicine. So that can you kind of see that's like it's like putting different tools in your toolbox.
Sure.
Okay.
Yep.
And it's really good. I mean, it's really, really good. But that's not holistic medicine. And a lot of veterinarians out there that call themselves holistic veterinarians are actually integrated practitioners. Okay, so what is a holistic veterinarian, or what is a holistic practitioner? Because they same thing in human medicine. Okay, a holistic practitioner is a practitioner that practices from a balanced mindset. A balanced mindset. Okay, what does that mean? We're all used to conventional medicine. Conventional medicine is all about using the intellectual mind to use deductive reasoning. It's problem solving. Okay, you've got a dachshund that goes in to the vet because it's been vomiting. Okay, and even though we're saying it's vomiting, it's a problem. The vomiting is a problem. So our job in conventional medicine is to solve that problem, find out why the vomiting is, and then we treat it. Okay, and that's basically what we're doing. All right, and so it's now when the practitioner's practicing from that mindset. Now remember, that person's been to like veterinary school. Like when I went to veterinary school, we're talking about 8 years of school. Conditioned, we're taught this how to think, how to practice. So we're very heavily conditioned our mind into that type of rationale, that type of thinking. And that's what we used to call left brain thinking, the old left brain, right brain.
Yep.
So that's all left brain function or left brain mindset. That's, again, what we call linear thinking, cause and effect. So that's how we approach things. Well, there in alternative medicine, like Chinese medicine and stuff, that is, we don't use the left side of the brain primarily. We use the right side of the brain. So we use right brain function. Right brain function is not linear thinking. It's circular thinking. It's holistic in its approach. It's interconnectedness. It's not reductionist. Left brain is reductionist, breaking things down to smaller and smaller parts so we can look at them and see how each part works. And we say that the whole is the sum of the parts. Well, in holistic medicine, holistic mindset, we don't do that. We look bigger and bigger, expansive and expansive, and realize the interconnectedness of everything. And when we look at it from an energetic standpoint, it's easy to see that because your energetic body, your pet's energetic body, has its own energetic laws that they're going to do whether you know about it or not. In alternative holistic mindset, we've got to use our intuitive. So if you went to a real genuine holistic practitioner, you would go in there, and you know what this person would do?
What?
They would sit there with your pet for a while. They would get quiet. They would quieten the mind, and they would get intuitive guidance that would come forward. We call it source energy, divine guidance, whatever you want to call it. So that you learn to use, and you know this, most women are much more intuitive than men are. Yeah. You learn to depend on that intuitive guidance. And so you're not only working with your intellectual mind and deductive reasoning, but you're just as much working with your intuitive mind that's giving you guidance. That's a balanced mind. That's a holistic mind. And they're extremely rare to find somebody that can do that because it's very difficult to go from left brain function over into right brain function and to go back and forth. And that's where a lot of people have problems. That's where a lot of integrated people, they don't have good success. And that's the reason that I stopped doing conventional medicine, because I wanted to totally focus on alternative so that I could get to where I relied on my intuitive skills more than I did my intellectual skills. It's just like when I would be working with the patient, maybe I'd be doing acupuncture, and I would have come up with a formula of point selections that I thought would help this pet. And then all of a sudden I'd open up for guidance, and then these points would pop into my head. And I knew that it's what they needed. And so you do it, and you got to where you relied on that. You absolutely relied on that. It's like going to source and saying, hey, give me some help here. I need some help figuring it out. Basically what you're doing. And if you understand how energy really works and subtle energy works, you have this higher being, this higher self, and your pet has this higher self. Well, this higher self, when you look at it from a quantum physics, some people call it soul or what have you. But when you look at these higher beings, then what we're talking about is interdimensional energy. And when you get out of that into a higher dimension of energy, and I don't want to go way out of here, but it's true. It's quantum physics that once you leave this energetic plane of third dimension, which is time and space, there's no time space, and so basically your higher being is in communication with your pet's higher being because they're the same energetically, and so there's a communication there. There's a communication and a knowingness. And so basically what you're doing is you're getting information from higher source, which is in the same as the higher self from your pet. And that's called awareness. And we just haven't been trained to do that. We haven't been taught how to do that. And it's so powerful. It's so powerful. And I tell people a lot when they've got pets that have terminal diseases and they're so emotionally distraught trying to make choices and what have you. And then I teach people how to do this, how to connect with their pet at a higher level and sit down and be with their pet and go through some exercises, and they connect energetically with them, and then they know what their pet wants. It's not a choice. They're being guided, and they go through the motions. And it's a wonderful thing because instead of this emotional distraught fear that they're with and that I'm going to make the wrong choice and everything, they're this connection, and then compassion comes out, unconditional love comes out, and then you're just in the flow. You're moving with the flow, and then you're doing what your job is, and it's a wonderful experience. That's holism.
So what might be a good example of that? I spoke a few weeks ago with animal communicator Dr. Kara Gubbins, and we spoke about just that, about using our intuition to speak with our animals and to communicate more clearly and effectively with our animals.
Good example.
It's not very often that our pets go naturally, and often as caregivers, we have to struggle with that decision. And what maybe you could share with us some of those exercises that you talk about how to use our intuition and sit with our pets and really come to the decision together rather than feeling like we've made that decision on our own, and maybe help make that decision-making process a little bit less stressful for caregivers.
Yeah, sure. And this is something that I told you I have a Facebook group, right? And I teach my students to do this, and they do it every single day, and it will change your life. If you will sit down with your pet for 10 or 15 minutes every day and say, this is going to be my time with my pet. Let's say your dog's name is Shotzi. This is my time with Shotzi. So I'm going to go spend 15 minutes with Shotzi, and I'm going to find a quiet place, and I'm going to, for this 15 minutes, 20 minutes, whatever time you that you're going to feel comfortable with, this is my time. And so what does it mean? It means that I'm going to be 100% in the present moment with my pet. Okay? And that's a very powerful thing. And so what does that mean? It means that when I go into the room or go into the yard or go wherever I go with my pet and I shut that door, then what it means that I'm going to leave everything out of that room. I'm going to be in there totally in the present moment with my dog. I'm going to leave out all the things that I have to do, all the things that I did. I'm going to leave it at the door. I'm going to come in there. I can get them, pick them up when I leave again. All the things I'm going to have to do later, all the things that I should have done differently, all the stuff that's going on in our head all the time. I'm going to leave it out of that room. I'm going to come in there. I'm going to be present with my pet, and I'm going to sit down. And the first thing that I'm going to do is I'm going to start petting him or her. I'm just going to start showing affection. And then what I'm going to do is I'm going to start talking to this pet, and I'm going to start telling them how grateful that I am that they're in my life. And I mean it. I'm going to really mean it because I am grateful. And I am really grateful. And I'm going to be petting this pet, and I'm going to be looking into its eyes, and I'm going to be telling them how grateful and appreciative because they've come into my life to make my life better. And they love me unconditional. And that's the only the only experience that I have of unconditional love. And so I'm grateful for it. And so I'm going to sit there and pet, and I'm going to feel it. And I'm going to feel that gratitude that I have for this pet. And if you do that and you genuinely drop your mind and get out of your mind and get into your heart, and you start loving your pet and you start being grateful for your pet, you're going to feel something happen. You're going to feel your energetic heart area, the center in your heart, the energetic heart, you're going to feel it open. And that we call that a heartfelt experience. You'll feel your heart open. And when you do that, when you feel that heartfelt emotion or heartfelt experience, then what happens is that source energy moves through your heart and moves through your pet's heart, and your energy connects, and you become one energetic unit. This is not some metaphorical voodoo thing. This is a fact. If you look at the work that Heart Math Institute in California has done, they will show you research that says when you do this, they contacted me and we worked together with this, and this is an amazing situation, because what they did was they put a cardiac monitor on a child, and they put a cardiac monitor on the pet, and they had them go through the same thing that I'm telling you about. And when that heartfelt experience opened, when that heart opened, they become a mirror image of each other. The same heart cardiac profile was a mirror of the other one. They became the same. We call that cardiac coherence. It became one energetic unit. But not only did it become one energetic unit, but then what happened from the heart coherence became a secondary thing called physiological coherence. And what happened for both of the individuals, the body was completely 100% efficient. It was in the healing process. It was in the healing mode, because source energy, the same energy that created the universe, is recreating in each moment that body for both of those people. That's exactly what happens. It sounds bizarre, but it is the most wonderful thing in the world. And if you do it, you'll connect, and it will change your life. It will literally change your life.
Wow. I feel like it's changed my life just listening to you talk about it.
It is so powerful. I can't tell you. I've had people that have come in. I had a lady come in one time, her cat, I can't remember what it had. It was several years ago. And she said, and I told her, I said, just all you have to do. I said, I want you to quit worrying. I said, just spend 20, 15, whatever, and stop worrying. Leave all these emotions, leave all these worries, and start doing this exercise. And she came back a couple months later, came into my office and gave me a big hug. And she said, oh my God. She said, I can't imagine. I couldn't even imagine what could happen. She said, I connected. I had compassion coming through. I felt unconditional love for my pet. It was amazing. She said, I just ended up taking her because I loved her so much, and I was connected with her. And then when I took her in to have her put to sleep, it was an act of compassion and love instead of this fearful thing. And she said, all I do is I still feel love. And you know how many people that when they lose their pet, they have all these negative emotions attached to it. I feel guilty because I either went too soon or went too late, or so they have all this. And when you do this and you learn to connect with your pet at their level because they love you unconditionally, you don't have those feelings. They're lower negative energy. You know what bad feeling energy feels like? Walk into a room that people have been arguing and fighting, and it'll hit you in the face and makes you feel bad. Walk into a room that people have been laughing and having a good time, it lifts you up. You know, energy has its own law, and the most powerful energy of all is loving source. And that's what you're doing with that exercise. You're connecting with energetic source coming to both of your heart energies. That is powerful. And when I teach people to do focused intention healing for their sick pets, that's what we do. We connect there. We get into source energy because that's where healing occurs. You know, nothing in conventional medicine has anything to do about healing. Nothing. Absolutely nothing. It cannot. It's based on fear. It's based on non-realization of the truth. So it can't create healing. Healing will only come from a loving source, not a fearful source. It's just that simple. It's like planting a garden. If you want to plant a healthy garden, you plant a garden in a real good, healthy, organic soil. You go and plant, your seeds in a toxic soil, you're not going to have healthy plants. And that's the same thing here, is that we get so wrapped up in this, you go to the vet and the vet tells you your dog's got end-stage heart disease, or your dog's got cancer, or your cat's got kidney failure, and then we go home and we're thinking about kidney failure, and we're thinking about our pet dying, and we're thinking about, oh my God, what's my life going to be like without my pet? And you get into this negative vicious cycle, and your energy just collapses. I mean, it gets so negative and so vile. If you could paint it, it'd be this black, nasty, thick, dense energy that is the last thing in the world that you can do to try to get healing that comes from that low-level, dense energy. And then here's your sweet pet over here that's got this imbalance problem, that we conceptually call cancer, what have you. And what do they need? They need loving, healing energy. And what we're doing is, when we're stuck in the swamp, we're just bringing them right down with us. And so what we've got to do is we just got to be aware of it. We just got to be aware. We don't want to bring that in. We want to bring in loving, healing energy. And that's why we start doing this exercise. And we start working, and then all of a sudden our energy starts lifting up. And then we no longer entertain this negative, dense energy. We no longer attract that into our lives, because like energy attracts like energy. And so if you're down there gloomy and doomy and scared and fearful all the time, then your life becomes a reflection of that.
So true.
And so that's what I tell people all the time. Our little pets, they come into our world. We didn't pick them. They picked us. They came in here as these little Buddhas or these little angels, and they come in here to teach us things. Unfortunately, they didn't come with a book that they could pass it on and say, here, this is what you can do to learn from us, And so many times we go through all these pets that time after time, and we just don't learn anything from them.
We don't open up to that.
And no one gave us an instruction book, and we've become so left brain thinking, and that when we start hearing things about this, it sounds so foreign that it's almost unbelievable.
When you were talking about letting go and using our intuition, lost my shepherd just over almost a year ago, and we planned for it. We had the time, we knew it was coming. So I was able to, spend the day and just really be with her. And then when it was actually time, we did Reiki, and we did it in our yard, and we played music, and it was very easy and beautiful. And I think after she had passed, some of my friends thought maybe that I should be sadder than I was. And I think because we were able to make it such a peaceful transition, that sadness wasn't the same. It doesn't mean she wasn't part of our family and that we don't miss her every day, but we let her go in a more beautiful and comforting way, so that we were able to really just ease the transition for everyone, not only for her, but for us as well. And
it is. And we're so conditioned to think, oh my God, how could that be so beautiful? It's so horrible. It's a mindset. It's mindset.
And it was weird to explain to people.
Yeah, and that's the mind. That's the old mind, the conditioned mind that says, oh no, we're supposed to be grieving. We're supposed to be feeling horrible. We're supposed to be crying, falling all over ourselves. Have you ever, what? I can't tell you how many hundreds and hundreds and hundreds of pets that I've had to euthanize over the years. And what just blows me away is that you have all these families in there just falling all over themselves, and what's the dog doing? It's sitting there wagging its tail. We're so far removed from what is natural. It's scary. And the thing about when you said, I tried to explain it and people don't understand, well, I tell people, explain to me what love is. Can you explain what love is? No, you can't explain what love is. You can kind of get an idea of maybe what it's like to you, but no one can explain what love really is. And you know why that is? Is because love is beyond explaining. Explaining is of the mind. Love, a loving source, the mind is within loving source. And so it's beyond the limitations. The mind can't do that. It's like, it's incapable. It's like going and asking a 5-year-old child to explain Newtonian or Einstein's laws of relativity. It's totally incapable. And so we can't explain loving feelings. We can't explain them. It's something we just have to experience. And that's what we have to, and that's that same thing that I was talking about with the old intuitive, that, loving interconnection, that's the right mind. That's the intuitive. That's the insight. That's connectedness. That's interconnectedness, And so that's where we need to learn to spend more time, especially here in the West. We've gotten so, black and white, so contrast and polar opposites, and that's all duality, and that's not holistic. Holistic is non-duality. It's interconnectedness. It's oneness. It's oneness among all. And those are things that can't be explained, because if you start explaining them, then you're using the left side of the mind again. So we've got to learn to be more at the level of our pets. Why do you, I love this. Why do you think pets can't talk to us? They can't talk to us because if they talk to us, then they would be using concepts and in describing things, and those concepts are vague abstracts. And so they connect with us in ways that are beyond the mind. And so we've got to relearn how to connect with them at the level that they connect with us. Oh my God, it's going to change your life. It's going to change your life. And you're going to learn a whole lot about yourself when you do it.
I think you should be writing that second book.
Because I tell you, I just wrote a blog and I would encourage people to go to my website, because I've got about 3 years of blogs on there, and I blog every single week. And I just wrote a blog within the last month.
Dr. Thomas, before you get into it, give us the website so that people are able to contact you.
Okay, it's www.drdenisthomas.com, and doctor's DR, so it's drdenisthomas.com.
Perfect. Okay, so go ahead and share with us.
But I wrote a blog 2 or 3 weeks ago, and the title of the blog was "Can You Love Me While I'm Dying?" And I can't tell you how many people contacted me and said, "Oh my God, it changed my life. It connected me. And read it. Go to it and read it. It'll explain to you what's going on. And it talks about the procedure the exercise that I was talking about and how it works. We've got to learn when it comes to our pets, we've got to learn to not just use that intellectual mind, but also use that other part of us, that wonderful part of us that we've forgotten that's there, that intuitive part, that loving part, it's such a wonderful thing. Because that's where our pets live. And if we want to be with them, we've got to learn to get energetically on the same tune, on the same level that they are. We do. Because when we do, that's where the magic happens. It is. It's where the magic happens. So I call that going down the hole. A lot of when I do phone consultations with people, and then I kind of, one of the first things I do within the first few minutes is that I try to get an idea how far they want to go down the rabbit hole, So what level do they want me to work with them? I just got contacted right before you called with a lady that wants to do a phone consult. And this lady is very, very spiritual. She's in Reiki master, and I know that when I talk with her, we'll be going all the way to the bottom. So to the rabbit hole,
Yeah.
And so I meet people where they are, and work with them where they are. And it's a wonderful thing. I love it. Sometimes I'll talk to people about their pets, and we'll talk the whole time about them, about what's going on with them. I had a lady this week, that same thing that it was yesterday, and most of all the problems that she was dealing with was problems within herself that she's struggling with. It had very little to do with the pet. You got time? You got time for another one of my stories?
Absolutely.
Okay. This is a fun story. When I first opened my office, my alternative only office, I remember I got a phone call from a lady, and this lady lived in California, and she had a dog. It was a corgi, and this dog was like 2 years old, and this dog was having these bizarre neurological symptoms. it was almost like a narcolepsy, but it would stagger around like it was having some kind of bizarre seizure or something. Anyway, but this dog, she had this dog down at Cal Davis, working with the neurologist, and she had working with her GP. She was working with internal medicine specialist. She was even working with a holistic veterinarian and what have you. And this dog was getting worse and wasn't getting any better. I mean, and she sent me videos of this dog. And this poor little thing, it was really not doing well at all. And so her parents lived in Spokane, and what she wanted to do, she contacted me and she said, I want to make arrangements. But she said, I'm coming for the holidays to see my parents, and I want to bring my dog with me to see you, and maybe you can help. And I said, sure, I'll be happy to. And I don't remember. I think she was coming for the Christmas holidays. And so anyway, I said, well, why don't I, and this, when I talked to her, I said, just send me all the information and I'll look over it and what have you. And that's when she sent me the videos and all the medical records and what have you. And I kind of wanted to see what was going on before she came. And so I remember reviewing it, and I would talk to her, and she would always call me right when I would close. And so it'd be late evening, and I would be sitting on the little love seat that I had in my office, and I'd be sitting, we'd be talking on the phone. Well, I talked to her 2 or 3 times, and one time she called me one evening, and we were talking, and I hung the phone up, and I just sat down, and I just kind of did a little meditation, a little 5-minute meditation, and that's what I did. I said, hey, and when I do this, and I get quiet, and I get out of that busy mind. And that's what I said. My focused intention was I need some help here, and it just download. I call it the download. It just came into my mind. And what happened, it said, it's not about the dog. It's about her. That's what this sense that I had that came to me. It's not about the dog. It's about her. And then I thought, well, okay. And then about that time, I got another download, and it was like, it's about integrity, the word integrity. So, and I was sitting here going, I don't have a clue what this means, but that's that same thing that I'm talking about. That's getting out of that busy mind, opening up, having an intention, and then guidance coming your way. And that's what it said. It said it's not about her. It's not about the pet. It's about her dog, and it's dealing with integrity. And so I really didn't know what that meant. And so I called her back on the phone, and I told her, I told her what happened, told her exactly. And I said, I don't know what it means, but I'm just passing along the information to you. And so she said, okay, thanks, and hung up the phone, and that was it. Well, I got an email from her a little bit later and said she had some problems with the flight, and she wasn't going to be able to come after all, and thank you for the help. And so anyway, I went on about my business. Well, several months went by, 3 or 4 months or something, and I got a card from her with a letter in it and a check. It was really cool that she sent me a check for my time. But the fact of the matter is, in this letter, and this is what she said. She said, after I got the phone call from you, I started thinking about it, and I started, the word integrity was very powerful. And she said, I had lost my integrity. She said, I have been living with a guy, and it's been a bad relationship, and a very bad, unhealthy relationship, and it's been affecting me, my health, and what have you. And she said, I realized that was not going to be an environment for my dog to heal with. And so she got she realized that her giving in to this bad relationship was a factor in this dog's health. And so she broke away from that, moved out away from this bad relationship. And she told me her dog is completely healed. No treatment whatsoever. No treatment.
That's amazing.
That's how powerful our influence is on our pets. And it's all about the energy. It's all about the energy. Have you ever read any of Bruce Lipton's work?
No, I haven't, but I really should.
Well, Bruce Lipton was a cell biologist at Stanford, and the reason I'm bringing that up was because his work in the lab, what they did was they examined the influence of the energetic body on the physical body. Okay. And that's a very, very, very powerful thing. What they realized was that the energetic body is the directive or the implicant for the physical body. And so imbalances occur at the level of the energetic body first. And if they go on long enough, then they show up in the physical body first in the way of emotions, and then secondly in the way of form. Okay? And the body's energetic influence is 100 times more powerful than the biological influence.
Say that one more time.
100 times. At the cellular level, energy influences cell function 100 times more than biochemistry.
Wow.
So your Reiki that you do for your pet is 100 times more powerful than the pill that you give for the same problem that you're doing Reiki for. Wow. At the cellular level. And that's proven scientifically. The body even has its own energetic receptors on every cell. And so conventional medicine completely ignores the fact that the body is energetic in nature and has nothing to do with the energetic component. So basically what they're doing is they're ignoring the most important component of our healthcare, of the health that we have towards ourselves and our pets. And that's the energetic influence. And I'm not talking about just in a stressful situation in your home. I'm talking, remember, everything is energetic in nature. Yeah. So if you're feeding a diet, and if you're feeding a diet that might be nutritionally sound, but if that nutritionally sound diet has been exposed to negative energy, then that negative energy becomes a component, a very powerful component of that. And then when that pet eats that food, it does its nutritional thing, but it also has that energetic component that is permanent. It's permanent. And that's what people don't understand about energy, is that when we come into an energetic and have an energetic influence, it becomes part of our energetic body. It doesn't leave. It doesn't just fizzle like a cloud passing. It becomes part of us. And that if it continues, and it builds up, and it becomes more and more energetic, and we become more and more out of balance, and we become unhealthy. And that's what these alternative energetic modalities are about, is reestablishing balance and putting that back into harmony. And the good thing about it, like you said, we're learning more and more about energetic healing. And there's just fascinating stuff out there. Focused intention healing. Oh my God, I could sit here and tell you stories all day long about focused intention healing and how powerful it is. Have you ever heard of the Power of 8 from Lynn McTaggart?
No.
That's stuff that we're doing with our Facebook group right now. Google this, write it down, make a note. Lynn McTaggart, Power of 8, and read some of her stuff. It's going to blow your mind. I promised it will blow your mind.
I will definitely. And one of the
ability to initiate healing.
Before we move on, and I forget, you mentioned Bruce Lipton's books. What book would you suggest someone start with? Biology
of Belief. Yeah, it's a really, really good. It's again a lot of quantum physics and a lot of science, but it's really good. I tell people that I use science as the bridge, because the bridge between our conditioned thinking, rational thinking, and this that we believe is mystical or spiritual. You know what I mean? And it's hard for us to be open to that. And so if we can use science to connect those two, to build that bridge between the two, then we're going to be much, much more effective. When I first started doing Chinese medicine and acupuncture, I was at my practice in Coeur d'Alene, Idaho, and I was there for many, many years, and we had great success. I mean, I was telling paralyzed dogs. I mean, I even had a cat that had congenital defects. We were seeing all these little miracles happening all the time. So anyway, ended up selling my practice, moved over to Spokane and opened an alternative only. And I got in there, and every person that came into my office, my new office, because it was in different state, different location, was somebody new. And basically, they were the same thing. They were looking for these things that couldn't happen with conventional medicine had failed. They were at a dead end, and so they're coming over here. And most of them had never had any experience with acupuncture, Chinese medicine, or anything. They were just hoping for a cure, hoping for a resolution. And you know what? I couldn't, it wasn't working. My success wasn't anything like my success that I had in Coeur d'Alene. I mean, I was treating patients that I'd treat the same thing, the same imbalances, the same clinical problems that I treated for years and had wonderful success. And I wasn't getting the same success over here. It blew my mind. I was sitting there thinking, oh my God, what am I doing wrong? What am I doing wrong? And you know what I realized? That my clients over in Coeur d'Alene, when I started doing Chinese medicine on them, acupuncture, I had already established them as clients, and they trusted me, and they had faith in me. And when I told them, hey, let's try Chinese medicine, instead of using drugs, let's use acupuncture or let's use Chinese herbs. And they would say, Dr. Thomas, I have faith in you. Whatever you want to do. They might not come out and say that, but they did. I'd say, sure, you bet. If that's what you recommend, let's do it. And they were open to it. Now, these people over here, they didn't know me from Adam. They didn't have that trust factor. They were very skeptical. And so they came in here, and that skepticism, they weren't open to it. And I finally realized that's what the block was. They weren't open to it. And their reality that they experienced would not allow, because of the skepticism, would not allow that healing to occur. So I had to change, and I had to go in there and teach them how to be open to it, not to believe in it, because you can't teach somebody to believe in something that they don't believe in. Mm-hmm. But I could teach them how to be open to it.
To the possibility.
And once I taught them how to be open to it and just be objective and watch for results, boom, all the miracles started happening again. And as soon as they saw the things happening, they were believers. And then I told them, you can't stop there. That's what I tell all of my people. Can't stop there. Now you're an ambassador. Now you have to go out and bang the drum. It's your job. Because that's the only way your friends and your colleagues and your all these people are going to learn is from people like you. It's not going to come from the veterinarians.
So true.
And we've got to stop all these dogs all these cats from being euthanized and using chemotherapy on. And I've got a lady that I dealt with today. They're using chemotherapy on a dog with mast cell cancer, and chemotherapy doesn't even work for mast cell cancers. Those cancers don't even respond to chemotherapy. And here's this dog. They're spending thousands of dollars in putting this dog through all this horrible treatment for what? For nothing. For nothing. And we got to stop this stuff.
I think you need to speak more and write that second book.
That's what my wife keeps telling me. But I am just enjoying doing these phone consults. I love it. I love dealing with people. I love helping them. It's so much fun. It's so much fun.
I want to be respectful of your time, Dr. Thomas. And so is there anything that you might want to get out to everyone that we haven't maybe discussed at this point?
There's so many things that most people that are listening to you are probably on the internet reading a lot of stuff. I guess the biggest problem that I see what's going on now is that it's really good that there's this movement towards a more natural, a more functional approach, and breaking away from the absolute listening to everything the conventional veterinarian says. So that's a wonderful movement. And take, for example, food. Okay, well, for so many years that we've been feeding heat processed pet food, and that was our conditioning. And the vets are pushing it, and they're selling it, and they're talking about it, and they're recommending it, and that's what it's been for generations. Okay, well, now what we're realizing that heat processed food is almost linked to every chronic disease we see in the pets. And so what we're trying to do is we're trying to transition away from this unhealthy food to a healthy food, a species-appropriate fresh food, preferably fed raw, And so what we do is we're trying to get people that have been so conditioned to feeding unhealthy food into a mindset of feeding healthy food, and then they finally make the jump over to do it. And then what they do is they find all this conflicting information. So what they've done is they've gotten out of their secure zone and gone into a little bit of insecurity, and then they're looking for guidance, and they get these conflicting stories. And so one holistic veterinarian tells them to feed this, and another holistic veterinarian tells them to feed this. And then pretty soon they're getting inundated with all this information, and they don't know what to believe. And some of them get so frustrated they say forget it, and they go back to feeding the old stuff they've used to. And that's the last thing in the world that you want to do. So I try to get all my holistic veterinary colleagues to sit there and say, guys, we all need to get on the same page, and so that we can, these people that jump on board, we've got to give them easy steps to follow, so that they can start seeing the results instead of confusing the heck out of them. And so, whether it's dealing with food, whether it's dealing with immunizations versus vaccination titers, whether it's, flea and tick control, heartworm prevention, all these things. So the problem that I see is there's so much information on the internet that is conflicting, confusing, and everything. Find a good holistic practitioner that you have faith in and confidence, and stay with that person, because whatever that person is going to recommend, if it's a good holistic veterinarian, then that person is going to take you places that are so much far advanced in what you've been doing conventionally that even if it doesn't exactly match what another holistic veterinarian is doing, the benefits are going to be leaps and bounds. And so don't get bogged down with all that information. Find somebody that you're open with. There's so much out there to do. It's just like I'm such a big guy on energy. I teach all my students how to use. Have you ever used a pendulum? You know what divination is? Okay, how to use a pendulum for everything, whether it's medications or supplements or food, and teach them how to use that. And so that anything that their veterinarian or their holistic veterinarian or whatever recommends, they whip out that pendulum and they test everything. And that, there's so many things that people don't have a clue that what divination is and how it can change their lives and how it can benefit their pets' lives. Energy clearing. How many people smudge their house, of bad energy? We need to be doing that on a regular basis. These are things that people are not being taught, and they will literally change their lives. So find a good holistic veterinarian that can set you up with a real good health program, stick with it, and just watch the miracles happen. It will.
I think it's safe to say we could end there. Watch the miracles happen. I want to thank Dr. Thomas again for sharing his amazing knowledge and dedication to holistic medicine and veterinary care for our amazing dogs. I really hope that you sit back with this episode and really listen to the experience and the knowledge that he has about holistic medicine and treating your dog, and really remember that just because one road or one option ends doesn't mean that it's the end, that there are other options, and that if you think about them now and research them now, when the time comes that you might need them, you'll be less stressed and might be able to make a better, more calm decision for your best friend. If you have a wiener dog story, an event, or a topic you'd like to see us cover, send an email, bark@wienerdoglover.com. Follow us on Instagram, wiener_dog_lover_, or Twitter @lovingwienerdog, or find us on Facebook, Wiener Dog Lover. Never miss an episode. Head on over to wherever you listen to podcasts and subscribe, and you'll be notified every time we put out a new podcast. I'd also be grateful if you would leave us a review. Until next time, Wiener Dog Lovers, this is Lori, Sheba, and the Wieners, signing off.